Those who know. Yeah, they are nice.
Yeah, but it only lasts for like 30 seconds. Oh, no, that's a different one. That's for the guy.
So it's handy.
That's why I said that. It is a nice pen. Up lower.
Which one were you talking about?
This one.
Thank you. Good afternoon. We would like to bring the August 23rd, 2023 Victoria County Council meeting to order. Just prior to opening it, we would like to acknowledge that this meeting is held in Unama'ki, one of the 7 tradition districts of the Mi'kma'ki and the ancestral and unceded territory of the Mi'kma'ki people. So with that, the agenda has been circulated to you. Are there any errors, or I'm sorry, are there any additions or deletions for the agenda? We good? Thank you. Can we have a motion to accept the agenda as circulated, please? Thank you. Councillor McLeod has moved. It's seconded by Councillor McNeil. All in favor? Contrary minded? Motion is carried. The agenda has been approved for August 23rd. So our first presenter today from the Alzheimer's Society is Catherine Shepherd, who is the Education Coordinator and Provincial Lead, and we welcome you to council. We haven't met you before, so welcome to council. And I know you have a presentation, and we'll perhaps let you go through the presentation and open for questions upon completion. Does that work for you?
Sounds great.
All right. Well, welcome, Catherine, and we'll turn it over to you.
Wonderful. So first of all, I just want to say thank you so much for the opportunity to join you this afternoon. I am Catherine Shepherd. I've been working with the Alzheimer's Society a number of years now, but I've been in healthcare for about 25 years. But I think one of the things that's really important today that we talk about and listen to is how not only the disease of dementia is going to impact us personally, but as a community. And so that's kind of what I've put together. I also shared with you a study that was done. It's called the Landmark Study. This is part 1 of 3. And so that is with you that you can take and read some light reading, if you will, at a time that suits best for you. I'm super informal as well. So if as we go through, you have a question that comes up that you'd rather ask right away, please don't hesitate. I'm happy to answer as best I can. If I don't have an answer, I'll get one for you and I'll get back to you. Okay. So I think the first thing we need to think about is, what is dementia? For a lot of people, if they haven't been touched by this or haven't lived this disease, it can be something that's not quite as tangible. But the reality is, and the truth of dementia is that this is a progressive illness. What we also know about this disease, which is hard to say and sometimes even harder to hear, is that this disease at this point has no known cure. There are medications that can help support the symptoms of this disease. But the truth is that this is a terminal illness. And so when we look at this disease, that's one of the things that we have to acknowledge sort of right from the get-go. We also at one point thought that this was a disease of the elderly. But again, in truth, what we're seeing now is people in our communities in their 30s, in their 40s, and in their 50s, all being diagnosed with this disease. So at one point, even though it may have been a disease of the elderly, it's certainly not what we would consider a disease of the elderly now. Oftentimes with a diagnosis of dementia, some of the things you'll notice first are a difficulty with memory and language. Those are generally the 2 first things that we see people start to struggle with. Sometimes, you know, people will acknowledge that there are struggles with their memories. I think first and foremost, though, it's important to say as we get older, our memory changes, and that's normal. Right? So many times as we get older, you know, and people start to not be able to remember things like they used to, there's worry and fear around that. And the struggle then that happens is, what should I do next? There's so much stigma still associated with this disease that people hesitate. They hesitate to have a conversation. They hesitate to reach out and say, I'm struggling with my memory. And then it gets to a point where if this is a disease of dementia, they've reached a point where medication may not be the best benefit for them. And so when we talk about this, that's one thing that I hope happens, is that we share. When we share, we decrease stigma. And so it's so important, not only for those who are living with the disease, but also for those who are caring for someone who is living with this disease. We have people that live in our community that have been diagnosed with dementia. that live very full, happy, prosperous lives. They live in their own home. They drive their own car. They do their own banking. They buy their own groceries. As the disease progresses, will help need to be put in place? Yes. But the truth is we have people that live very full lives and people that have been diagnosed with the disease that share that story with us. And so I think it's really important that we acknowledge that as well. I also think it's important that we say, you know, that dementia is arguably one of the greatest health challenges that Canada's aging society is going to face. What makes it even more daunting is not knowing the scale of the challenge and the impact on Canadians, and then the huge impact that's going to happen with our healthcare system. Okay. So in 2023, there are an estimated 17,000 to 20,000 Nova Scotians who are living with or being diagnosed with this disease. This is an estimate simply because compounding factors such as a lack of access to diagnosis and over about 110,000 Nova Scotians without a healthcare practitioner right now can really impact that. But what we do know is that many people, especially members of rural or equity-seeking communities, do not have access to the help and the support that they need. And even those that do often struggle with the limitations of our overburdened healthcare system. And so one of the things that we acknowledge when we start off, when we say that number, 17 to 20,000 Nova Scotians, we know that we're probably on the low side of things, right? We have lots of people who are struggling with their memory and not getting a diagnosis simply because they're afraid, simply because they don't have access, simply because they don't have someone to navigate, simply because they don't have the support that they need. We often see it more in rural communities as well, right? At the Alzheimer's Society of Nova Scotia, we believe that everyone affected by dementia has the right to live their life the way they want to live it, whether they're living with the diagnosis or supporting someone who is. Core to that belief is that everyone has the right to be the person that they are and to live without fear of prejudice, regardless of race, regardless of age, regardless of gender, regardless of sexual orientation, regardless of faith, or regardless of disability, like dementia. There is a Charter of Rights for the persons living with dementia, created in Canada, created by people living with dementia, for people living with dementia. Everyone should have the opportunity to contribute to society in a way that feels right for them, and we stand behind that. We all have the right to live in a world that demonstrates respect and values diversity and works toward true inclusion for all. In saying it, it's here in the smaller sort of communities that we continue to work and grow to show this same inclusion. In bigger communities, you know, people have an access. They have an access to people, they have an access to supports, they have an access to resources, they have an access. But in smaller communities, we are working to ensure that people do have that connection. And although small communities sometimes have the best ideas of how to support, they don't always have the same access to that support. So I put this slide up because I think it's really important when we look at some of the services and programs that we have. Sorry, I thought I had populated this a little quicker, so I'll do it all at once. Here we go. And what I want you to think about is this. The blue is the help for today. These are the direct services and supports that are in the here and the now. Okay. The orange is the hope for tomorrow. And these are the stewarding changes via the system levels that we have to look at. Something like advocacy, community engagement, for example. These are the things that we can grow. The landmark study, which is the study that you were all given earlier today, was released in the fall of 2022, and it's provided us with the first new dementia data in about 12 years. The projections are startling. And I think when and I hope you'll have a few moments to take some time to look through the landmark study. I think you'll be amazed by the numbers that you're going to see. It's estimated that the current numbers will almost double over the next 30 years. And Alzheimer's Society of Nova Scotia estimates that right now we're probably only reaching 15 to 20% of the population that has been affected by or living with dementia. And these are some of the impacts of the landmark study. What you'll also notice is that this is step one in a 3-step series. Okay. So let's take a moment. Let's really look at where we're going with dementia and really think about what this means for BDEC. All of the regions of Canada are expected to see an increase in the numbers of people living with dementia if these current trends continue. However, the growth of dementia cases will not be uniform across the country, right? We would expect that we wouldn't see anything uniform. We know that dementia will affect the provinces differently over the next 30 years. Differences in age distributions, migration patterns, the prevalence of risk factors combine to produce specific challenges, needs, and overall numbers of people living with dementia for each province. So in 2020, it was estimated that there were just about 600,000 individuals living with dementia in Canada, right? That alone is a pretty staggering number to me when we think about it. By 2030, which really isn't that far away, we can expect this number to be close to 1 million. Okay, so that's our Canadian number. In terms of new cases per year, in terms of new cases per year, in 2020, there were about 124,000 new cases of dementia diagnosed. So that's about 10,000 per month, about 350 per day, about 15 every hour. Let that sink in for a moment. By 2030, the annual incidence will rise to about 187 new cases a year. So just about 16,000 a month, 512 per day, 21 every hour. So when we look at these numbers, what I want you to think about, what I want you to sort of acknowledge is, why is it important? Right? There's lots of numbers that we can throw around that can be staggering, but I think it's important that we think about, why are these numbers important? So let's look at documenting costs of care. Let's look at loss of income for people. Let's look at other challenges, financial challenges, especially for persons with dementia and their families. And let's look at these as what the municipality can do to help and support, acknowledging that growth, help, support, all of those things are so important to these people. Providing benchmarks against which future progress can be assessed so that all sectors can use them with confidence is key. And informing service planning and policy development at all levels and helping organizations work plans, budgets, and projections can also be a great help to people. And while many care partners may find their experience rewarding, as in dealing with the person who's living with dementia, because we do hear that all the time. There is great reward that comes from this, from being a care partner with this disease. We also think it's really important to acknowledge and recognize that that caregiving role can have a negative impact on health, quality of life of the care partner. And in saying that, we then know that that can be a burden on an already overburdened healthcare system as well. In Canada, most people living with dementia reside at home. The goal right now is to keep people living well in their own community as long as it is safe for them to be there. Safety has to be, and I always laugh because I say safety trumps everything, but Trump has now become sort of a dirty word, so I try not to use it as much anymore, but safety has to be the trump. Safety is the decider, but the goal is to keep people living in their own home for as long as it's physically possible and safe for them to be there. Most older adults in Canada want to maintain their independence and remain in their communities for as long as possible. When people who are living with dementia live in their own communities, as this disease progresses, there are things about them that still never change. Things that all of us around this table share in common as well. We're all different ages, we're all different races, we all have different beliefs, we're all different genders at birth. But the truth is, we want to feel purposeful, we want to feel meaningful, we want to feel useful, and we want to feel needed. That does not change for a person who's been diagnosed and living with this disease. And so those are things that we have to keep in mind when we start thinking about how can we support. Purpose, meaning, useful, needed. That doesn't change. People living with advanced dementia often can't manage on their own in their own home, right? It's then that we know that safety becomes a concern. And it's at that point that supports and access to services have to kind of have doors opened for them. Due to the progressive nature of most dementias, people with dementia who live at home will eventually need an increasing level of medical and social support, which may ultimately present challenges to their family and friends who act as care partners. And even though care partners talk about the joy of caregiving, and we know that there is that, we must also acknowledge that it can place some great stress, and this can add that stress and strain on our healthcare system, as many who are challenged to maintain their own health, as well as support the person who is living with dementia. Canadian statistics have shown that for people living with dementia, here are some interesting ones. 1 in 4 require help for activities of daily living. Those would be things like personal care, bathing, eating, cleaning home, those sorts of things. 1 in 4 exhibit behavioral changes, and those are the reactive and responsive behaviors that happen because of the disease. People oftentimes will say, I hope my person doesn't swear. I hope my person doesn't become violent. I hope my person doesn't. But the truth is, every person with dementia is unique. Just like you and I, we are all snowflakes before the disease and diagnosed with the disease. That doesn't change. And so what one person may exhibit doesn't mean all will exhibit. But there are 1 in 4 that will exhibit those behavioral changes. And it's that reactive and responsive that can sometimes be most difficult for people to support. We know that 1 in 4 people diagnosed with dementia are suffering with depression, right? That's a big number for people. We also know that 1 in 4 were admitted to hospital at least once in the last 3 months. And we also know that at least 1 in 4 have had an emergency room visit in the last 3 months. Those are big numbers. Those are big numbers for a hospital visit where beds are at a premium, and for an ER where space and support, healthcare support, are at a premium. So you're probably wondering at this point, well, what can we do? So I'm glad, I hope you're asking yourself that anyway, and I'm glad if you are. Dementia is often described as a public health challenge about which nothing can be done because it's due to what people think of as an aging population. But this is false. Research has demonstrated that there are actions that can be taken that may help reduce the risk of dementia developing, and there are things that we can put into play to keep our brain healthy. While some risk factors like age or sex at birth or genetics can't be changed, right? These are known as unmodifiable risk factors. There are lots that can, and these are the modifiable ones. So this is sort of the impact that you could see on long-term results. So modifiable risk factors include a range of things like lifestyle or behavioral factors, diet, exercise, social activity, as well as heart healthy, intellectual activities, and protecting your brain from things that can increase your risk of developing dementia. What's good for your heart is good for your head. I oftentimes too say one of the things that, even though we may not be able to cure dementia, one of the things that we can do is look at how do we reduce a lifetime exposure to modifiable risk factors that would allow us to delay, maybe even prevent dementia from occurring in many people. One of the things I think is also really important to say and acknowledge right from this point is stigma. Stigma is huge within our community around the diagnosis. People don't want to share. People are embarrassed to share. People are overwhelmed. When you get a diagnosis of dementia, what people will say to me is, I hear nothing else but the pulse in my own ears at that point forward. They're overwhelmed. But what I'm going to ask everybody to do is live a life that helps people reduce the stigma, to allow them to go to the top of the tallest mountain and say, I have been diagnosed with dementia, and then allow the doors of support to open. People will say, well, what do I do then to reduce stigma? Right? We're going to talk about it. We're going to share about it. We're going to learn about it. Those are the key things that we can do. But I also ask you to do this. Don't joke about it. Don't joke about it. Oftentimes we say jokes, we make fun of things, but we would never do that if someone was diagnosed with cancer. We would never do that if someone was given a diagnosis of ALS. And I ask you to do the same thing now for this disease. If we look at this narrative of hope, because there is one, what we can say is a 10-year delay of onset for dementia would result by 2050 in Nova Scotia, dementia prevalence of 8,320 people. So it's lower than our 2020 estimates, effectively changing the whole trajectory of this curve. If we achieve this from the start of this time frame, so this 10-year delay in onset would see Nova Scotia avoid about 71,000 cases of dementia. While there is a growing list of risk factors that can be labeled as modifiable, many Canadians may not be able to make all of these positive changes due to personal situations and resources. You know, we can say to people, try to live in a great community that doesn't have any exposure to. But for people that may not make a whole lot of money, living in a certain area in a community is generally more attainable when it's not the most desirable, right? So is that modifiable at all? Probably not for them, right? Eat healthy foods. So what we talk about is environmental things, things that are unhealthy in environment. So the steel plant in Sydney, right? It puts out, or put out, not anymore, but it put out a lot of, right? I'm trying to think of the right word as I say it, right? It put out things into the environment that are not healthy for our bodies. But unfortunately, if people don't have the income to live away from that area, then they have to live where their money will stretch to buy a home so they have a roof over their head. Food is another one, right? If you ever go into Sobeys and you look at how to buy a red pepper, and a red pepper costs you $4. But if you go down to the frozen food section and the Hungry Man meal is $2 on sale, or buy 10 for, $8. Right? If you've ever watched the I don't even know what they're called, but the little kids meals that you pull apart that have like the little piece of bread, the little piece of cheese, the little piece of meat. And you watch that one where they open it and they leave it on the countertop for 3 months and nothing grows mold, but it's really affordable, right? You have to wonder what sort of chemical is put in it, right? It's all of those sorts of things. What I say to people is, you have to do and acknowledge that not everybody has the money to buy a red pepper, a broccoli, a bag of grapes, blueberries, raspberries, strawberries, all of the things that we know are healthy for our body, right? 3 lettuce at Sobeys was $9, right? That's a lot of money for people. That can be the difference of a week's worth of feeding your child at school if you buy the Lunchables, right? And so factors that are only truly modifiable, if the Prosper support and the public supports with the proper support, public health agencies and other governmental agencies can really look at what can be modified, because there is an impact and there is a narrative of hope if we do that. When we focus on risk factors for dementia, the interventions and the actions, they're often examined through the lens of an individual. But from a population perspective, this is of key importance. And so this is where you come in, because even the slightest delays in dementia onset can have a huge influence. The whole population approach aims to reduce everyone's risk factor across society. This could include actions such as new legislation, investments in infrastructure, other broad approaches at the community, the provincial, and the federal level. So while a cure or an effective treatment for dementia has not been discovered yet, we can take a wide range of actions to create positive outcomes for people living with dementia and their care partners. And by that, I mean, I want you to be part of the future of dementia support in Nova Scotia. So I challenge you. At this point, I challenge you. So what can you do here in Bedeque to help be part of the future of dementia support? So working towards developing age-friendly, dementia-friendly action plans and brain health plans, right? It's easy. Support accessibility initiatives in that urban planning and designs that include clear wayfinding signage or transit accessibility for people. And by wayfinding, I'll explain what I mean by that, because that may be a term that not everybody is used to. A lot of times people say persons with dementia can get lost. We don't use the term lost, because if I were to go for a walk, if I got up right now and I said, I think I'll take a walk, people would be like, oh, Catherine's going to take a walk. But if someone with dementia got up and said, I'm going to take a walk, suddenly people are like, she's going to take a walk. Where's she going to go? What's she going to do? Is she going to get lost? So we don't use the term lost, we use the term wayfinding, okay? So support accessibility in your public areas, your bathrooms, making sure they have a sign of a toilet. Words can be hard, pictures can be easy, right? Those are sorts of things that we can do. We can consider, the health impacts in all of our policy making and support health promotion efforts at all levels of the government. We can encourage all staff, all city staff, all village staff to take a dementia-friendly course, right? If you own a business, is your business dementia-friendly, right? Those are things that we can do. We can plan for increases in spending in home care, for social support and long-term care, and then to match the expected increase in the number of people with dementia and their care partners who will have to access these services. We can improve access to healthcare clinics with additional focus on those underserved urban and rural areas. We can enhance strategies to improve the mental health of older adults with specific targeting on reducing the impact of depression in our adults over 65. We can support federal efforts in dementia surveillance. Provinces most urgently need to start to enhance the tracking of diagnosis more accurately. It will let us know where our people are living because right now we don't have that, right? When we say 17 to 20,000 Nova Scotians, people always go, how many people in Cape Breton? We don't know. We need to respond to care partner challenges, specifically in the rural and remote settings where support is often lacking. So I've been tossing around that sentence, dementia-friendly community, for a bit now. So what makes a dementia-friendly community? Social environment considerations, dementia-friendly spaces, dementia-friendly businesses. That's what makes a dementia-friendly community. Dementia-friendly principles make spaces more, sorry, I did it again. Dementia-friendly spaces make your space more inclusive, it makes it supportive, and it makes it accessible to everybody. That's what we want. We want inclusive, supportive, accessible. What I will truly say is we don't have all the answers. Solving major, deep-rooted issues such as access to primary care, better supports for rural communities, supporting caregivers and obtaining diagnosis. It's a long and complex process. We know that. But when we talk about dementia, bringing this reality to the forefront, acknowledging that if we do nothing, this is going to have a devastating effect on the community, makes us acknowledge that even changing small things can bring great impact. And so that's what I force and challenge back on you today.
Thank you very much.
Question me.
Most informative, and
Welcome.
we do appreciate you raised the bar of awareness for Alzheimer's. It's affected most of us probably in one way or another through family members or relationships that we do have. So I would like to open it up to questions and I'll start with Councillor Patterson, if you wish.
Thank you, Catherine. I'm just wondering, is there any research on the genetic component to Alzheimer's?
Yeah, so it's a question that I get all the time. My mom had dementia. Does that mean I'm going to get dementia? And the truth is there is a lot of research that happens, but what we do know is that the genetic impact of dementia is very small. Generally less than 5 to 2% is what 2 to 5%, I should say it that way, is genetic. There are some populations that are being studied because they do have a higher number, a higher prevalence of people being diagnosed with dementia. And so there are lots of questions that come from that as to why. So there are some studies happening, but generally it's less than 5% of our cases are genetic. Oftentimes, I will say this, oftentimes people that are diagnosed when they're young will, oftentimes, I will say this, is that for people that are diagnosed when they're young, so in their 30s or 40s, oftentimes you'll see them get genetic testing done. Why? Well, it's unusual, right? We don't often see or think of dementia as the first thing when someone who's in their 30s goes and says, you know, my memory's really bad. We don't often say, oh, it's dementia right away. But the other reason that people will do some genetic testing at that age is that we're still at a point in our life where we may be considering having or starting a family. And so if there is a genetic component, then they like to let people know at that point.
I noticed in your statistics that about 2/3, 66%, 65% are females.
Yes.
And in my family, for example, I had 5 aunts and uncles, plus my father, three males, 3 females. 2 of the females had Alzheimer's. They're well in their 90s
Yes.
when it happened. None of the males did.
Yeah.
So is there any research on that part of the
The reasoning
disease?
why. Yeah. So it's more common in females that are assigned female at birth, I should say. And what we see is that women live longer. And so that is a risk factor that we see. But there are some studies now being done to look at different hormones, how that impacts our brain and the long-term result of those sorts of things. But Alzheimer's disease is more common in women. And we see that about 67% of all of Alzheimer's disease is women.
You got any questions or comments? Please
Yeah.
make sure your mic's on.
Thank you, Warden, and thank you, Catherine, for the presentation. It was excellent. I'm just wondering, is there like any underlying like diseases that will cause dementia and Alzheimer's, like heart disease, or
Yeah.
Is it more common in people with heart disease? And
So those are the things that we consider risk factors, right? So people that have that chronic disease, let's use heart disease like you brought in. So people that have heart disease that is untreated, uncared for, that can lead to things like a stroke, which then can impact brain health, right? Can then increase your risk of being diagnosed with the dementia. A lot of times with specific types of dementia. And what I'll say is dementia is an overall umbrella term that I use. Some people will often say, well, I'm glad I was diagnosed with Alzheimer's disease and not dementia, or I'm glad I have dementia and not Alzheimer's disease. But I want you to think of dementia as the overall umbrella term that lists a set of symptoms. Those symptoms underneath that umbrella, if you will, are the different types. And what we see is Alzheimer's disease, the most common form of dementia. It's often what I say is the handle of the umbrella, but there are somewhere between 70 and 90 different types of dementias. So acknowledging that, our brain is the control center really for our body. When you have another chronic illness that you don't particularly take care of sometimes. So let's say people have, they're diabetic and they don't take care of their sugar. How does that impact you long-term and brain health? You have heart disease, but you choose to eat, fatty meat, right? Not exercise, all of those sorts of things. How does that impact long-term brain health? And they are risk factors. Lots of people live with diabetes and live very well. They take care of their body. They take care of the symptoms of diabetes. And so that in and of itself doesn't make it a risk factor. It's the people that don't take care of those chronic health issues that we see lead to brain health issues.
just one other question. Like in my district in Over Home, it seems like almost every family is directly or indirectly affected by either dementia or Alzheimer's disease. And a lot of the people stay at home and want to stay at home, and they're better, healthier staying at home. But is there programs out there like for respite for family members that?
Yeah, so there's tons of support that is available. Right now, we do know, however, that accessing home supports can be very difficult, right? Just like our healthcare system in so many ways, there's the great need, right, for home healthcare. But there are lots of programs that run that can allow people to stay in their own home. In more urban areas, so I'll use the Sydney area just because it's closest to us and a bit more urban, but the opportunity for day programs is there. The ability to have your person be social, be fun, have fun, take part in a daily activity. A lot of people who live with dementia that go to these day programs think of it as work, right? I'm going to my job. This is my job. And it gives them great purpose and meaning. But on the same breath, it also allows the care partner who's still at home time, right? Time to go to the dentist, time to pick up groceries, time to take a bath, time to get my hair done, right? Time to get the car fixed. And that can be something that's most positive and helpful for a care partner, right? But there are programs, supports, resources, and services that are available. It's just getting access to them in your community.
Thank you, Counselor. Counselor Long, any questions or comments, please?
Want to thank you, Catherine. I don't have any questions, so I'm going to check out your website.
Perfect. Thank you.
Thanks, Barb. Counselor Oregon.
Thank you, Catherine. Very, very, very good. I had some questions, but the other counselor, he got ahead of me, so.
Yeah.
So, but is the reason Nova Scotia has so many people diagnosed with it is because of our aging population?
Aging population definitely does play a role. When you read the landmark study, you'll be surprised to see that we are probably one of the smaller numbers across Canada. But we have a smaller population as well. But I do think, we have to look at what we can do to keep a healthy brain and how do we decrease that number? Because that's something that we really can impact. We really can see a big impact with it. And if we talked about what we can do to keep a healthy brain, and I shared those with you, nothing would surprise you. There would be things on that list that you would be like, absolutely, that makes sense, right? These aren't things that are unattainable, right? For us to do. Are some of them out of the reach financially for some people? Perhaps, but there are things that we can do as a community that can help with decreasing that number.
Thank you.
You're welcome.
Donald, any questions or comments, please?
Yes, thank you, Warden. Thank you, Catherine, for a well-spoken presentation.
You're welcome.
When you spoke of the day programs,
Yeah.
what would be the best way for us to get that into the extreme rural areas of Victoria County?
Yeah, so a day program can be run at all kinds of different levels. There's one that can be run by VON, and that's part of its own standalone support service. But there are others that are run with the support of occupational therapists, recreation therapists, CCAs, LPNs, those sorts of things. And they're run in a space that allows people to have activity, social support. There's lots of things that we can look at bringing into a community that allows people to still maintain their independence. We talk about, Montessori activities for older adults with dementia. And so those are really great intellectual things that can be put into place. Having someone come in and play music. It can be as simple as that. A day program can be however you want it to look, as long as the space that you have is accessible and allows people to be safe, be welcomed, and take part. When we look at day programs, there's an ebb and a flow to who attends every day. Sometimes Monday, Wednesday, Friday is super important, and so everybody will come. Sometimes, Tuesday, Thursday, I'd rather stay home. But it becomes a support for people that they can access when they need it, how they need it. Most day programs run from, say, 9 a.m. to 2 p.m. So that gives the care partner some time and space to de-stress and take activities of their own in. It allows a healthy lunch to be served. It allows people to have access to social support, which a lot of the times can be one of the biggest things we see. People pull back into themselves. It's easier to stay home than have to go out and answer questions about why I can't figure out where I am or what's wrong. Those are things that can be really hard for people. And this is a space that's inclusive. This is a space that's accepting. And this is a space that's accessible to everything I need.
Thank you very much.
You're welcome.
Thank you, Deputy Warden Duffy.
Yes, thank you, Catherine. Great presentation. You mentioned, and I've been seeing it also, where people in 30s and 40s are starting to be diagnosed.
Yeah.
Is that because there's better diagnosis out there, or better ways of diagnosing people, or has it always been there, or is it maybe our environment has changed so much?
So I'll tell you, interestingly enough, one of the benefits of our healthcare system is we are learning lots of things. For a long time, people will say to me now when I do a presentation, they'll say, why are our numbers so high? And the truth is, I think we probably always had a significant amount of dementia, but we're talking about it a little bit more now. Just like, let's say 20 years ago, no one ever said the word cancer. Now we run every October and we wear as much pink as we can, and we're proud. And I want us to get to that point with dementia. We're not quite there yet, but I think the truth is we're calling it what it is. We're calling it dementia. Before you'd hear people say, well, that lady's crazy, or that man is senile, or she has hardening of the arteries, right? If you've ever heard that term tossed around, they have organic brain disease. Now we say it's dementia. You're welcome.
Councillor McLeod.
Thank you. Thank you, Catherine, for the presentation. Was eye-opening with the numbers. Just when you charted, let's say the tomorrow chart about the provincials and government, do you have a close conversation with them as Alzheimer's Society? Because my question is about the long-term facilities. They have it's overworked, it's hard in the staff, and sometimes the planning they have for them is not the correct one because could be violence or could be different. It's hard in the head for the worst stuff. So I just want to know if the society is talking with the province about how to make it better for them.
Yeah. So the Alzheimer's Society, although a nonprofit charity, we receive a portion of funding from the government. And so there is constant conversation, not only around the support that the government provides to us, but ways that we're putting that funding to use. So we talk about programs, although we as the Alzheimer's Society are not part of that long-term care umbrella, if you will. We have different programs that with the support of the government, we're able to educate staff in long-term care. So we acknowledge that the burnout is great. We acknowledge that the stress is high. We acknowledge that it's a really hard job. We acknowledge that those that work to support those living with dementia, it's a job where lots of days no one says thank you. It's a job where some days you wish you could be anywhere but where you are. But the government funding allows us to do different programs that then support the person who is caring for the person with dementia. When we talk about responsive and reactive behaviors, it's a lot of times where people will talk about the difficult moments of the job. You know, there's lots of beauty in the job working in long-term care. They form bonds with people. You know, they are family of people because essentially you go into work into somebody's home when you work in long-term care.
Exactly.
But it allows them, when those moments are difficult, to look at the why behind the behavior. Because what we do know is that every behavior happens for a reason. A behavior doesn't happen just because. A behavior is reactive or responsive to. So trying to be the detective, the Nancy Drew or, the Hardy Boys or whoever you are, trying to be that person to figure out the why behind the behavior can then help either mitigate the behavior or support the behavior from happening again. And so with the government support and funding, we're able to do those types of programs. And then we're responsible to go back to the government and say, we've met these KPIs based on the funding that you were able to give us.
Thank you.
You're welcome.
So we have a question, and I'll wrap up, but
I just wanted to say on behalf of the Senior Safety Program that Alzheimer's Nova Scotia has been a wonderful community partner. And we'll be able to set up Catherine coming to do this presentation and also at our other seniors groups throughout the counties, working with in collaboration with Home Support, we've been able to set up presentations at the seniors lunches, etc. And also to establish training for senior safety program coordinators across the province. So I'm really grateful for Catherine to come and give this great presentation, and I hope that this will create opportunities with council to be able to just go forward with some ideas related to supporting dementia here across the county. And one thing I noticed that you didn't bring up about the risk factors that I think is so prominent in this area. And the geriatric psychiatrist spoke about it at her lunch presentation, didn't she? About the effects of alcohol. I think that's one of kind of the initiatives that can span across different things that council is involved with. Thank you for your awesome presentation and your support.
You're welcome. It's my pleasure.
so just before we wrap up, just a couple of quick questions. Your presentation, do we have that or can we?
Yes.
Can you, so we have
Yeah.
it, that's great.
I'll just get my speaker's notes removed from when we send it, we'll send it as a PDF. Okay. Super. Super.
And the second question I had for you is accessing your services. Is it by referral or just any member of the public can contact? you?
Any member of the public can contact. The Alzheimer's Society of Nova Scotia has a dementia helpline
Yeah.
It's a 1-800 number. It allows people to connect with support. And what I will say is that we get that support return phone call to them within the same day generally. And it allows people to connect with resources and community where they are.
So are there many individuals accessing your services from Victoria County at present, or do you see some?
So here's what I can say. I don't know the numbers from Victoria County
Right.
off the top of my head, but what I will say is this. Coming into the dementia helpline or support line, that 1-800 number, there's probably 10 to 12 phone calls a day that come into that. And we offer an outgoing or an ongoing support services via phone because most people find that the easiest. And with the staff, my colleagues that work on that dementia helpline, what I will say is we have social work, we have masters in counseling, we have death doulas, we have, you name it, we've got the support in our society. It's not a volunteer run organization. It's an educated staff. And they probably make anywhere from 20 to 30 outgoing calls as well a day. So we're probably making upward of 30 phone calls, my colleagues and I, a day to people living across the province who are on this dementia journey.
So if we were to not necessarily promote, but make some awareness of your program, it would be the 1-800 number.
The 1-800 number and the website allow people to connect to not only a real person, but resources that meet them where they are, for what point of the disease they're in, for where they live in the province. So we have the joy, right, of COVID, if I can say that, is that we've grown our services so that we're not site specific. We allow people to connect to virtual support groups. If there isn't one in their area, they can connect to a virtual one. If they don't quite know how to connect to a virtual support, we have a tech person on our team who calls them and says, let's get you set up. We have, all kinds of opportunity for people to connect into education sessions. We have different family and friend events that happen in communities that people at no charge or cost to themselves can access. We have provincial conferences that if people are interested but can't make a trip to Halifax because that's where a provincial conference is held, it's a virtual option, right? So there's so much. Again, if I can say COVID brought us one good thing, it's going to be that. It's that we've been able to expand our services to allow people, no matter where they live in Nova Scotia, to have access, so that even if someone in Halifax can walk in and talk with someone in Dingwall can call and get the same support over the phone.
Well, listen, I want to thank you very much for your presentation. It was extremely informative, and I certainly, for one, know more now than before you came. So,
Good.
and I can't speak for others, but it really, and with an aging population, it's certainly here.
Good. I'm glad to
So-
hear that. And I encourage you all to take a peruse through the landmark study. This is landmark 1, but there will be 2 more that are coming out as well.
Great. I hope you will come back again when the other 2 studies come back, and
I would be pleased to.
hopefully we'll be able to report back that we've seen much more awareness and activity with the Alzheimer's Society as a result of your visit today. So
Wonderful.
thank you
And I
very
will
much.
share too, we've done some great things in Bedeck, and I feel like it's slowly starting to kind of accept us a little bit more and a little bit more. So just as Cassandra said, we've been able to offer presentations to the public here at the Bold Center. We are in contact with the library about memory kits and how do we get memory kits within. If you've noticed that on Global News, that the memory kits through the library, we've done You First, which is the training we talked about for healthcare professionals. So in your long-term or in your home care setting, we've done it in Bedeck. So we're slowly getting there.
Good.
Little bite by little bite.
And when you get the opportunity, we'd like to see those presentations and information sent north as well. So,
Absolutely.
well, thank you very much again. And thank you, Cassandra, as well. So we're going to take a 15-minute break, and we'll reconvene in 15 minutes. Thanks again.
Thank you. Thank you, everyone.
Thank you.
So we're reconvening council, today's council meeting, and in the agenda, the next item up is the minutes from our August 1st, 2023 meeting. Those minutes have been circulated to you. Are there any errors or omissions in those minutes? No errors or omissions have been brought forward, so we would entertain a motion to accept the minutes as circulated. It's been moved by the deputy warden, seconded by Councillor McDonald. Thank you. All in favor? Contrary minded? Minutes have been approved for our August 1st meeting. So with that, the next item on the agenda will be the CAO's report, and I'll turn it over to Leanne.
Great, thank you. So I've sent my report out to all. I just want to go over just a couple of things in there that that you should be aware of. So the land in New Haven has been purchased from the province and has been migrated. So we can now start the next phase of the transfer station development. But we also are going to have a public works meeting because there's some things that have happened over the last bit. One in particular, EPR is becoming or has happened in Nova Scotia, which could affect, we don't know how yet, but it could affect our operation. So we're going to be having a public works meeting somewhere scheduled near the end of September related to that. Municipal boundary review was approved by the UARB as presented. So there's I think 4 councillors who may have a slight change to their districts, and that has been approved. The proposed district changes are what UARB accepted. So there's no change to the number of councillors, but just possibly a change to your district boundaries. So as I had mentioned, EPR is now official. It's expected to come into effect in the next 2 to 3 years, which is extended producer responsibility related to recyclables, and the impact of how we collect and process our recyclables at this point is not known.
Can I just
Yeah, sure.
interject for just a minute? I think just for those of us that have had previous experience with the EPR, it's very, pardon me?
You're right.
12 years ago, we met in Truro with the then minister,
Yes.
and we left more confused than when we arrived. So it's a good point. And I think if we're going to have staff present on behalf of Public Works, I think we should ask for one of the Department of Environment and Climate Change to have a representative there as well, if that would be it.
Yeah, we've asked that also.
Great.
To have them come
Press.
related to this.
Yep.
We'll
Great.
have to see if we'll put a request
Yeah,
in for sure.
exactly. Thanks. Sorry to interrupt.
No, that's okay. So one other change related to C&D collections that we have. As you know, there have been changes in the C&D guidelines, construction demolition, which is related to treated wood that we are no longer allowed to accept at our transfer station. We're in the first year. It came into play July 5th. As of July 5th, 2024, we will not be allowed to accept anymore. We are in the public relations getting word out piece of it currently. We're going to be doing some communications plans around it, but just so everyone is aware, we are still collecting residential C&D, but we are not collecting from any government entities. And I believe Cassandra has sent out to all of you the New Horizons for Seniors grants. I had a discussion with her yesterday. She said that it's very easy to apply for, and it's for any seniors groups. And there's a large pot of money. I don't think there's any limit on how many groups can get it. So we're encouraging you to forward it to any groups that you think might be interested. The deadline for that is September 14th, 2023. Related to
Catherine Shepherd's information related to wayfinding. That is one of the steps that we're going to be working on for the next step of our accessibility plan. So we're going to be doing wayfinding within the building here. Just a couple of other things related to our washroom saga or washroom journey that we're on. We have put out a new expression of interest on the washroom CCAN that we have. It's going out to all of Victoria County. So if anyone knows of any groups that are interested in taking it over and operating it, we do have this piece of capital that we are willing to partner with. And also just to let you know that we had heard from Department of Environment, I believe that they had a surplus piece of property down along the Bedeck waterfront, and we told them that we had an interest in it. And we were the only group that put in an expression of interest on that, and we were awarded that. So we will be setting up the next steps related to it. I think it's something that could help with our trail usage or boardwalk also. Yep.
I think that was Department of Public Works.
It might, it was.
Yes,
the-
it
the
was, yep.
Provincial surplus land.
Yes, Public Works, yeah.
So those are the points. Does anyone have any questions related to anything else on my report? Yeah.
Transit about the tenders. We have just two responses, so.
Yes.
Are we going ahead or we need a
Yes.
meeting or what?
Yeah. So I think that they've been, and they've been, what's the word I'm looking for? Evaluated, and the tender has been awarded for the two hybrid vehicles.
Yeah, because
Yeah, and there's a bit of a lag on those.
Yeah.
There's 2.5 to 5
5
months
months.
for
We
them
just get
to
it
get
out,
here. And so I believe that that will be coming to a transit meeting also as an update.
Okay,
related to that.
thanks.
Councillor McNeil.
Yeah, thank you, Warden. And Leanne, I'm wondering about the water meter data and the Excel compilation and
Yeah.
stuff. What's going on? there
Yeah.
with the-
So as anyone who's in the water, in our water utility area, encompassment, knows that it has been a struggle with this contract that we have seen. So another piece related to it, not only on the meters, there's some difficulties that are happening within our system related to the numbers rolling in and the software for updating the water utility consumption amounts. So Alan has been working diligently on this. And so our water bills are going out next week. They're a little later than, they are later than normal, but it's because there's a lot of back work that has to happen for this conversion. And once those are out, the next bill will go out on time. It may look like a small amount of time in between the two bills, but they are for this. Everyone should be expecting to have received a bill already, and then their September bill will go out, hopefully, fingers crossed, on schedule.
Will there be a letter accompanying the bill explaining what's going on? I'm just wondering about
Will be-
complaints that
Right.
people will
Right.
have.
We're anticipating that, so we're looking at some communications around it.
Thank you.
Thank you, Councillor. Any other Deputy Warden?
Yeah, thanks, Warden. Leanne, in the under tourism, it said that Dan was in, I guess, communication about the English Wilderness area that's
Yes.
proposed. I'm just wondering if he could, because myself and the warden did meet with the ministers on this subject.
Yeah,
Um,
yes.
And we haven't
that
heard
was-
anything back. So I'm just wondering what he's hearing, because we haven't heard anything.
Yeah, so he has looked into different areas for the multi-use trails and our trail project. And there's actually 4 areas that he's found that are still on the suggested protected areas.
Proposed, yeah.
And the Ingonish Wilderness area is one of them. So Dan brought that to my attention yesterday. I reached out again to a different contact that I have at DNRR to see if they can pass me on to whoever needs to hear about this, because we're not interested in any more protected area. And so I'm hoping, or if we have to, then we can see about having another meeting, because this is not, we have an abundance of protected area.
Yeah, it's definitely not acceptable.
Yeah, not acceptable. So that's what I have related to that.
Okay.
I haven't heard back from this contact who passed on my my concerns.
Okay.
But when I do, we're going to send off the letters that we've written on it, remind them of the meetings that we've had, and request another meeting if needed.
Okay, and if you keep myself and the warden updated, when we
Yep.
did meet with the ministers. 'cause
Yep,
it'd be
definitely.
interesting to- We could
Yep.
follow up ourselves also.
Definitely.
Thank you.
Thank you, Deputy Warden. Any other questions or comments in regards to CAO's report this afternoon? I do. I just have a quick one. At our last council meeting, the presentation was made by the Clean Foundation
Yes.
and the Cape Breton Partnership, and it was noted in your notes as
Mhm.
well that the Economic Development Officer was interested in it.
Mhm.
I think I would like to, if you would contact the EDO and ask him to come to council and give us an update on not only his involvement in that, potential involvement in that project, but others as well.
Yeah, sure.
So that we all know. To me, that was with the amount of coastal erosion and the amount of climate influences we've had in the last 3-4 years. I think that's important. And if they're going to take the lead on it, we need to know that. If they're not, then we need to take the lead on it. So if you could follow up with him, that would be excellent.
Yep, for sure, because they've also hired a green staff member
Right.
who is working on clean initiatives also. So, yep, it could be a combination of him and another member of the.
Yeah, I know I speak for everybody with the damage we've seen in the last 3 years. The coastal protection is critically important, but we just need to identify who's doing what. Any other questions or comments in regards to present or to the report today? No, thank you, Leanne. We're going to move on to, we're going to skip recess since we just had that. So we're going to move on to district concerns. We'll start with Councillor McLeod, please.
I just have one comment. I have my accessibility meeting in August 17th. And I just have one person. So I invite all my residents for the next one is in September 7th. So if they have to, I will be in the courthouse, just they're welcome just to have a talk and check the concerns. And I have only 2 letters, if I can, congratulations letters. One is for Emmett Buchanan. He represented Victoria County in the Legion's tracks and field. He was the 23 overall from the Nationals with a best, personal best 40.40. So I just want to congratulate him for his effort and success. And the second is for Fraser McLeod. He is, congratulations, he went nominated for coaching in Nova Scotia team. So for track and field too. So, and good luck in his next year in university. So it's a congratulations letters. I will pass the email address for them. And my roads and reported to Steve. So everything is good in district too. Thank you. Oh, okay. I make a motion. Thank you.
No motions today, but I did want to thank Steve McDonald and his staff for the work that's being done in District 6. We're actually seeing some good work being done. And a couple of updates. I did talk to Steve this morning about the washouts on Smoky, and they are pretty well completing on the south side of Smoky. The north side was still quite bad, and they are hoping in the next couple of weeks to get to the north side to get that done. The bridge at the head of the harbor, they started to do some reconstruction on it, and for some reason just gave up and haven't been back in about 3 weeks. Steve has told me today that, or the supervisor told me today that they're just waiting for traffic control and we'll be getting back to repairing that bridge. So that'll be looked after. And I've also completed some brush cutting and stuff in the area, so it's greatly appreciated. The second thing is more just for information. There is still a lot of concern about the ambulance service north of Smoky. It's being taken out on a regular basis, probably every day. It's gone for most of the day. But there is a group that's been put together north of Smoky that has met with MLA Bain last week, and we are meeting with the EHS rep just dealing with the north of Smoky issues from a community group in the next week, and hopefully we'll have some success, but just want to let everybody know that it is being worked on, and that's good.
Just along those lines, Deputy Warden, if I could, the Premier was in southern part of the county 10 days ago, and I had a chance to discuss some of the issues we're facing, and certainly brought up EHS North of Smoky very much. And we also mentioned the Minister of Health happened to be in town as well, and mentioned to her as well. So they're both well aware of it. So
I appreciate that,
I
Warden.
think
Thank you.
follow up with something in writing for sure. Councilor McDonald, anything for your district, please?
Not really any motions today, Warden, just with regards to Public Works, as Deputy Warden has stated, there's been some shoulder work taking place and all good stuff in that area, but I did have a group of constituents, oddly enough, on the road that I live on, Courtney Road, have written to Public Works and MLA Bain in regard to the state of the road, the deplorable condition that the road is in. And with this RIM funding, the area manager said that patching will take place, and I think it was back in early May, I've requested that, and still has been no work whatsoever done to the road. So I brought it up again, and there was a reply from Mr. McDonald saying that the road needed a substantial amount of work, and it would be looked at in future years when the Cabot Trail piece would be looked at. So I don't really know where to go with it because the road is in really bad shape and at minimum needs some patching and ditching and graveling. So I guess I'll reach out to MLA Bain again and see if we can maybe get a better answer for that. And that's really it for District 8. It's pretty quiet on the home front and
Very good. On
That's it, sir.
vacation. Thank you very much for that. And I think, yep, the roads are a provincial responsibility, and therefore that's directed towards the MLA. Councillor Organ, anything from your district, please?
Oh, pretty quiet on the home front, like Council McDonald's. I had a complaint about Marianne Falls being closed, so I directed them to contact Parks Canada. And I had complaints about overnight camping in the White Point Road again. As we all know, there are camping all over our area. And I spoke to DNR and they said anyone can camp on Crown land. So we can't do anything about that. And I was also at the meeting with the deputy warden here for the ambulance. So looking forward to getting something solved there. As with Public Works, I'll be contacting Steve with the following. We need some brush cutting. Shoulders of the roads are in desperate need of filling. And I will be asking for my no parking sign for White Point school bus turning again. And that's it. Thank you.
Thank you very much, Councillor. Councillor Patterson, anything from your district, please?
Thank you. Yes. Yeah, a couple of things. I had a call from a fairly new resident that had a discussion about green bins. And I know we've had this discussion before, and maybe we could ask that be put on the agenda of the Public Works meeting, just a brief summary of why we don't have them. I think the last time it was the cost, right? Because they'd have to purchase them. Plus, I don't believe our trucks were equipped to handle them either. So if we could just kind of get that in writing, and then I can get back to that person. Secondly, I'd like to take $1,000 from my district budget payable to the Black Rock Cemetery. For those of you who recall, excuse me, a few years ago, the Black Rock Cemetery is located on Black Rock Lighthouse Road, which there has been some controversy about over the years. The road is getting in need of some maintenance. So the cemetery and the residents are going to split the cost of it. So I'd like to move that I would take $1,000 from my district budget to payable to the Black Rock Cemetery.
Do we have a seconder for that, please?
My second.
Second by Councillor McNeil, all in favor?
All right.
Contrary minded, the motion is carried.
And just with your indulgence, Warden, two other things that I forgot to put on earlier.
Sorry, Councillor, I'm sorry.
Just wondering if you know the group that was.
Black Rock Cemetery,
Is that who the check is
that's
going
it.
to go
Yeah,
to?
that's the check date. Yeah.
Sorry, go ahead. sir.
Just on the Federation of Canadian Municipalities front, the first board meeting of the year is scheduled to take place on September 10th and 11th, I believe, in Yellowknife. So I got an email last week indicating that it might not happen. I haven't received any official word yet, but just to let you know that. And also, one of the forums or committees of the FCM is the Rural Forum. And they elect the chair and vice chairs of that forum. And I haven't decided yet. I've got a couple more days, but I may put my name forward to stand for one of those positions. I don't know the implications right now, and I'll find those out before, hopefully. So that's it. Thank you.
Thank you, Councillor. Appreciate the update. Councillor McNeil from your district, please.
Yes, thank you, Warden. I sent around my district concerns. I have a list of some of the items from, for Nova Scotia Public Works. People can see them in the minutes after just a couple of main concerns I had spoken to Steve McDonald and MLA Keith Bain about, or correspondence with them. The condition of the Little Naras Ferry Road right to McKay's Point in Washabook. I was told earlier in the spring that there would be patching done throughout the area, and only a little area in front of the gypsum plant has been done as of today. And there's a number of issues that's not being done in my district. Again, one more issue is the gypsum outcrop in Jamesville. I've brought this up the last number of years, and nothing has been done. And I don't even know if they're looking into it. I think they are. They say they are. Hopefully, something in the near future will happen, because it is a dangerous area. Also, I'd like to make a motion that a letter be sent to John Makrovich, Nova Scotia Public Works Manager, in regards to the following two items. The ferry operating signs, the first meeting over 10 years ago, I asked for the signs to be upgraded, and he said yes, they'd be looked at right away. Nothing has been done as of today. And a bigger signs and flashing lights, just like, I don't know, just like the English Town Ferry, they should have, just to warn people that the ferry isn't working. Also, the restrooms or toilets at the Little Naras side have been out of order now for months, and they have a porta potty there, but it's not sufficient for like elderly people waiting for the ferry. And there is a lot of traffic and a lot of waiting time at that new ferry. So I make that a motion. That 11%.
Thank you. Councillor, do we have a seconder for that motion, please? Yeah, Councillor McLeod. Sit. All in favor? Contrary minded? Motion's carried.
And I'd like to make a motion that a letter of congratulations be sent to Vince McLean on the release of his second book. These Were My People, Washabook 1817 to 2017. It's a book of genealogy and stories of the Washabook area.
Okay, that's a motion from Councillor McNeil. Do we have a seconder, please? It's seconded by the Deputy Warden. All in favor? Contrary minded? Motion's carried.
And I'd also like to make a motion that a letter of congratulations be sent to the Washabook Community Center on another successful Along the Shores of Washabook Festival. It's the 15th year for the festival, and
Wow.
very successful. At the breakfasts every morning, they have a breakfast every morning, and there was over 120 people at every breakfast, basically. So,
It's good breakfast.
yep.
We have a seconder for that second letter, please. Second by Councillor Longo. All in favor? Contrary minded? Motion is carried.
That's it. Thank you.
Thank you, Councillor. Councillor Longo.
Thank you, Warden. I'd like to thank Councilor McLeod for bringing up her office hours because I never, don't think to mention that. And mine are September 6th at 6 o'clock at the Indian Brook Fire Hall. If anybody in District 4 wants to come and meet me, they can come there or they can call me anytime, as they know. I had a request for a street light to be removed from Goose Cove, and I would like to take that street light and put it on the Trans-Canada Highway in South Haven at a business that requested one for safety reasons. I did fill out the forms and I will pass them along to Steph. Had a complaint about the Big Harbor Road, and these complaints have been ongoing since 2019. That road is in bad shape. I don't know if it's on the list of roads to be repaved, but the entire road needs to be repaved, but it's really bad towards the end of it. I wanted to thank Steve McDonald and Keith Bain for coming and meeting me in Tarbert Vale to look at what's left of the damages from the storm that we had when it took out the bridge, and the bridge still remains in the river, but Steve said he's getting in touch with the Department of the Environment, and they are going to come because you're not allowed to work in the river without their permission. So they want to remove the bridge and also the creosote beams that floated down the river and are on another property. He said he would clean all that up and beautify the area as well. And I think that's it for me. Thank you.
Thank you, Councillor. So my district number 3, just a couple of quick notes. I just would like to make a motion to send a letter to the Village of Commissioners of Bedeque. They had an election a couple of weeks ago, and there were 3 that were successful, 2 that were new. So I think just a letter to have congratulations to the village commissioners on the new appointments, and that we look forward to working with that group as we move forward.
So we have a motion on the floor. Do we have a seconder for that motion?
Second.
Second by Councillor McLeod. All in favor? Contrary minded? Motion passed.
And just a couple of other quick comments, and this has been expressed by some of the others before. I don't know where the overnight camping is coming from, but it's really been an issue this year. We've seen them at the school parking lot. We've seen them at different locations. Some of the church, there are, as others have said, there are private campgrounds here that rely on that traffic. So I'm not sure how we enforce it or not, but I just think I just want to mention it, as others have, is that we are hearing about it. I'm not, and maybe we'll ask the CAO to perhaps see if who we contact to deal with that. I know some signage has been put in place, but the church parking lots, the school parking lot. I know up here at the school, they put a sign up and I don't see, one night there was 10 different campers. The rink parking lot, there was 3 rigs in there one night. So we have to, that's coming at the expense of people that are operating businesses in this, and some of those vehicles that are parked in there are worth $200,000 or $300,000. So I would think that the cost of a overnight site shouldn't be anyway. I shouldn't say that, but that's the way I feel. My office hours will be September 13th, and thank you for mentioning that. And I should have mentioned it. And then you were very wise to put yours on Facebook. I did not do that. I had my first office hours here, and there weren't a lot of people coming in to see me, so I'm going to try to do that next time. And I think it's good advice for those that aren't doing, including myself. The last thing I want to bring up is the public works issue. And normally I don't bring up public works issues because we let them know. Down on Water Street, there has been a manhole that's been above the paved area for probably going on 3 weeks now. And it is right on a 90-degree turn. It is an absolute traffic hazard, and it's also a safety hazard. And I mentioned it to Mr. McDonald, and he said the next time that they're doing patching in in the village that they would address that because they have to reseat that manhole cover. But it's been a couple of weeks and I think it's very much something that we shouldn't be waiting for much longer. So I just want to make sure that several people have complained to me about it, that we brought it to council, and we just to send a reminder to Steve as well that we've received multiple complaints in that regard at that location. That's it for me. Yes, ma'am. Does your,
I just wanted to, I want to request a no exit sign at Kelly's. I wanted to request a no exit sign at Kelly's Lane. There was one there previously, but it was stolen. And people think that that road, like a GPS will tell people that they can get to the Trans-Canada from there.
right?
So people have tried it and the road, they've damaged their cars, people have got stuck. So is that Steve McDonald? I did send him
Yes.
a note to him. I thought it could be him.
Yeah.
Okay,
It is, yep.
thanks.
And to your point, all of council bring up the public works thing, although we said the generic ones go through, but if there are ones that if they offer significant danger, certainly if you're hearing about them, certainly bring them to council. And that's a perfect example, as is the Water Street issue as well. So we're going to move on to, that's it for district concerns. We're all good. So council, I put this on just because I wanted to clarify some of the confusion that happened earlier amongst council and myself in particular. And I just would suggest a couple of changes to our travel policy, which the policy itself is quite good, quite straightforward. We have agreed to post our expense accounts online. And we had discussed previously, but we didn't put in the policy that we would be satisfied with submitting your expense accounts every 3 months. Problem with that is that we're going 3 and 4 months and not longer posting our expense accounts. So I'm asking council, is anybody opposed to submitting their expenses when they have expenses on a monthly basis? And it just keeps things current. And it's just, I think it's a more efficient way. So we good with monthly? I'm going to hold you to it. So, and there are some months that you don't like, well, I can't speak for others, but there are some months that I don't travel, so I don't submit. So sometimes that's why it's not there, but if it'll be our understanding that we'll submit on a monthly basis and try to get it in within the first week of the following month. The other issue is there's some confusion, and I've been part of the confusion as well, that we have some committees that, for the most part, you charge your mileage to the municipality. If you were appointed from council to a committee, and then for the most part, those expenses are billed back to the municipality. So we have a council committee and we have a boards list that we have here. What I'm going to do with that, I would like you to take a look at this list. There's only 4 or 5, rather than to go into the individuals in public. I would like you to check with your board. If they pay mileage, you claim through their organization. If they don't claim mileage and you're there on municipal business, we will claim it. And that way there's no confusion about, there's to be some clarity on what we're actually charging for. So did you want to comment on that?
I just wondering if we can get a copy of whatever the travel policies are for the boards that you sit on, so that we know as well.
And it is just housekeeping and good business. So with that, and I will circulate this around to you today. So if you're on any of these organizations, myself included, double check. And it's not a problem for us for you to submit, as long as we know that that's what the board or the committee has agreed to. So with that, is there any questions about that?
There's also one other change that has to be made on it related to the mileage rate.
Right.
Because we were to amend that to follow the provincial standing rates for those, and which would be updated yearly, I believe. So that change will be on there as well.
And just with that policy, I'll ask Leanne to reflect those changes. That policy that we did originally sign goes back to 2015, so it's updated and you're all familiar with it, and it's part of your orientation package, or you should be familiar with it anyway. And like I say, it's just to eliminate any future confusion. So the next item that is on our agenda this afternoon is Provincial Service Exchange renegotiation, Municipal Government Act review discussion. So I'm not sure who requested that to be put on, but Councillor McNeil, if you want to start the discussion, and we'll go from there.
Thank you, Warden. I took part in a Zoom meeting on Wednesday about the agreement, municipal and provincial agreements proposed. And the road aspect of that agreement, the road aspect of that agreement has been kind of worried that they're looking for a 50% from municipalities if road work is to be done on certain classes of roads. And involved in that, I think our local roads, G, H, I, and J roads. With that, they sent around a spreadsheet on how many road systems that would involve with each municipality in Nova Scotia. In Victoria County, I think it was 500 and wait, overall 506 kilometers of roads that would involve in Victoria County. I took my district out, but 121 of those kilometers are in my district. And right now, the work, there hasn't been a lot of work, maintenance work done in the past number of years. And I'm wondering, I'm scared that they're waiting for this to be passed, for the work to happen. They say we can opt out right now, but on that meeting, they didn't confirm that in 5 years that might change. So again, if we opt out too, will that put us lower on the list of these jobs being done? So I think we should write a letter to the province stating that this has to be looked at again in the agreement. And I'm just looking for other opinions on councillors' opinions.
Thank you for that, Councillor. Anybody else want to weigh in on that?
Yeah,
Councillor Patterson.
thank you, Councillor McNeil. I sat in a session yesterday and there were two things that struck me. First one to do with Public Works. The statement was made a number of times, they'll do what they've always done. Look at the list of stuff we have, they'll do what they've always done. And that's kind of their answer. The other one was a very good question, I thought. One of the gentlemen on the call asked, what are the objectives and the outcomes of these changes, especially with the roads? And my question, which I didn't ask, will the roads be better after this or not? So, I think those are general overarching questions. To get into the weeds, as they say, with the numbers, that spreadsheet to me, I had absolutely no idea what it meant. There were figures there. I don't know if they were above or below or beyond or what they were. So I think more communication, and maybe we'll get it tomorrow at the regional meetings. I don't know if they're going to be differently structured or not. Hopefully they will be, where there'll be a smaller number of municipalities represented. They'll give us more indication of what it means to us in Victoria County. I guess we'll have to wait till tomorrow and see.
Tomorrow, yeah,
how
the
that's gonna
meeting is
be.
on tomorrow at 1 o'clock. Councillor McNeil.
Yeah, just one other aspect. Deputy Minister LaFleche was on that meeting on Wednesday, the former Deputy Minister for Public Works. And they basically want any concerns by the 1st of September for the municipality. So it doesn't give us a lot of time to write our concerns down about. I think the rest of the agreement looks okay, but the road part has to be looked at again.
And you're right, and I think without going into great detail, and I'll have a couple of comments when everybody else has had made theirs. But yes, we don't have to get into exact details, but if we are flagging roads as a concern, that's a concern. Yeah, so no, I'm with you on that. Anybody else? If it's okay, I can just tell you, I sat on that committee with Service Exchange, but it sounds better than it is, because Service Exchange, as municipalities, we can suggest, we can recommend, we can advocate for what we want. But at the end of the day, the province of Nova Scotia holds all the cards, and they can enforce whatever they want. At least they took the opportunity to ask for input from a group from across the province. So I agree with you that if we have concerns, or if you take a look at it, we have flagged roads, and I think a lot of other municipalities, particularly large rural ones, they're a concern. And when I look at it, there are three options for roads, which I won't necessarily get into, but one of them is you can opt out, but it's never said for how long, and that is a concern. And the other issue is, well, if you opt out, what's that mean to maintenance? Do they kind of opt out as, did they prioritize the roads, and now these roads will be even in further disrepair than they are right now? So I can assure you that those same questions were brought up at that committee by particularly people that came from rural areas. And some of the other more progressive places that need roads, they like it, they'll adopt it. But for us, I absolutely agree with you. We should very much flag it as being a big concern to us.
And like it was mentioned at the meeting too, if rural municipalities have to pay for road upkeep, it's a quick way of bankrupting a municipality.
Absolutely, absolutely. And not only that, you saw the list of roads that we have and who let them get into a state of disrepair, and now they're potentially looking at trying to hand them over. So to your point, I think it would be probably incumbent that if you wish to make a motion, that we send a letter in with, ask CAO to come do up a letter directly to them and outlining our concerns.
I'll make that a motion.
Do you have a seconder for that, please? Second by Councillor Longva. And if you do up that letter, if you would just circulate it as you usually do, so we know it's gone. So all in favor? Contrary minded? Motion's carried. Any motions or proclamations this afternoon? We're good. The correspondence has been forwarded to you. We had a list of correspondence came out with our council package. Any questions, concerns about any of the correspondence that has been forwarded and or received? Yes.
I did neglect to say that we're having, Nova Scotia Power was contacted and they did reply, and we are having a meeting at the Indian Brook Fire Hall in September to ask the community to ask questions and be informed on what's happening at the Rec Hove project, and to ask what their evacuation plan is, or their emergency plan is if something like a dam were to break in
Right.
Rec Hove. So thank you for the staff who contacted them, and they did reply.
And that's open to the public. So everyone, it's just not district, although it's in your district and that's where Rec Hove is. Yeah, it's open to the public.
The 19th of the Tuesday? Okay, then it must be Tuesday.
19th of September. Okay.
Indian Brook Fire Hall. No, that's fine. I think that's.
Should-
Yeah, I think the EMO should be there and Keith Bain, I was gonna ask him also to come and, yeah, maybe you'd like to come too.
Yeah, sure.
Everyone's welcome to come.
Yeah.
Yeah,
Great, thanks, Barb. Thanks for setting that up. Thanks to the staff that provided assistance. That's dealt with correspondence. Any committee reports? Councilor McLeod.
Just asking if we can set a transit meeting for next council. Please. Thanks.
Yep, we can do that, and we're just going to set the dates for the September meeting, so we'll combine those two, but thanks for the reminder. Any other committee reports? Any questions from online? None? Nope. Jennifer's indicated we have not received any. Okay. Just before we go in camera, we need to set dates for September. Just opening my calendar here. So if we stick to Mondays, clearly Labor Day is out. So we're looking at the 11th. The 11th is good, and potentially, if you don't mind, 5 o'clock. Okay, if. Are you working the 11th? We can make it the 12th. Is the 12th okay with everybody? That would be Tuesday, the 12th, and just at 5 o'clock for now. And with that, it's tentative. We may be able to move it up earlier, but we'll go back to 5 o'clock. And after that, we are looking for a transit meeting. With the 12th work that day, and we'll set it up for 4. That work? And we also, we're looking for a public works meeting. If we do that, the following Monday would be the,
No. So hopefully we can wait until late September.
I was thinking the 25th.
Kelly's hoping to have more information on some of the topics, so
Would the 25th be late enough?
I'll have to check with her.
So let's tentatively schedule a public works meeting for the 25th, but we'll have a council meeting for the 25th.
Okay, probably. We'll check, see if that works.
So we'll tentatively schedule the 25th if everybody's okay with it. And just to your point that we raised earlier by the deputy warden and others north, like EHS, I know through staff have sent several requests to confirm their attendance at council. There's nothing, we have received no response. So I just, in light of the issues that have been having down there, and it's all of Victoria County, it's north to the most, but everywhere is being cleared out. They move those ambulances west, the most eastern parts are the first to lose. So I think if maybe the suggestion of either, and particularly those of you north, I think we should send our letter and a request to the president or the director or whoever, the CAO of EHS, and because local is, it's not being responded, so maybe we go to the top on that one. But I'll leave that up to you if you want to make a motion to that effect. You can make it.
I'll make a motion. We send a letter to whoever's the head of EHS to meet with us as soon as possible in regards to the ambulance service in Victoria County.
Yeah, and we will meet
Anywhere.
at their convenience, virtual, live.
Exactly.
It does, and it may be a special meeting of council to do it,
Mhm.
but I think it's important enough.
Oh, definitely.
to do it.
Definitely. Okay, good.
Do we have a seconder for that, please?
Second that.
Thank you. Councilor Organ has seconded that. All in favor? Contrary minded? Okay. So we do need a motion to go, we set those dates, the 12th and the 25th, if I'm correct, 5 PM. And we need a motion to go in camera, please. Moved by Councilor McNeil. Second by Councilor Organ. All in favor? Chet? Moved by Perla, seconded by.
Second.
So we have a motion to come out of in camera by Councillor McLeod. Do we have a seconder, please?
Second.
Councillor Long, go ahead. Seconded, all in favor? Contrary minded. We had brief discussion in camera. Do we have a motion to accept the recommendations from the in-camera meeting?
Moved.
Moved by the deputy warden, seconded by Councillor McLeod, all in favor? Contrary minded, motion's carried. We have a motion to adjourn. Thank you. We are adjourned. Thank you for your time and attention.